Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about musculoskeletal coding guidelines part 4. In this part 4, I am going to cover 5 important minor procedures that will be used for you. You can utilize this topic for your CPC exam as well. So those who are not watched last video, please check last video. So in that musculoskeletal part 1 was fracture and part 2 was fine procedure and part 3 was arthroscopy. This is the last part in musculoskeletal. So in this section, 5 important topic I am going to cover. Then those who are not subscribed my channel, please subscribe my channel and press the bell button and select all. Then only you will get my all new videos as notification. Okay guys, let's start from first point, wound exploration guidelines. The code range from 20100 to 20103. So this procedure especially for traumatic cases that result from penetrating trauma. So for example, gunshot or stabbing that will be penetrating the trauma. So this procedure includes extensive dissection or debridement, foreign body removal, ligation and coagulation of minor blood vessels. So we cannot code this set of codes separately. This all procedures will include in the exploration. Then if exploration procedure if performed along with the thoracotomy, laparotomy if performed, so then we should not code exploration as a separate code with this main procedure. Okay, so whenever if a doctor is performing simple or intermediate complex repair that does not require wound enlargement, then we can report closure from the integumentary system. Okay, so the first point is we should have to check whether it is gunshot wound or strapping. Then second point will be so whether main procedure like thoracotomy or laparotomy performed or not, then complex repair they performed or not, we have to check these 3 points. Okay, so that's all about exploration procedure. Then let's start excision of not biopsy procedure. So in this biopsy procedure, as usual, I am explaining this same biopsy in each chapter. So this biopsy is applicable, biopsy guidelines is applicable for all of the chapter. So as I explained you in the surgery coding guidelines, basic surgery coding guidelines, whatever the points are there in the basic surgery coding guidelines, that points will be applicable to the all chapters. So this is the one of the point. So biopsy, whenever biopsy performed with the more extensive procedure like any excision, repair, destruction or removal, so with those procedure we should not code biopsy procedure if it is the same anatomical site. If it is different anatomical site, then we can code both together with the 59 modifier. So this is the first point. So whether it biopsy along with the more extensive or same site or different sites. So check this point. Then this biopsy CPT code is based on the type of the biopsy, whether it is muscle or bone, then depth, either superficial or deep, then method of the biopsy. So whether it is open method or percutaneous. This is about biopsy. Then next coding guidelines is excision of subcutaneous soft tissue tumor. So this coding guidelines actually just based on the either it is above the bone level or deep fascia like that. So you have to check that information from the medical record. So as per the guidelines, thus benign nature, actually the tumor will be benign in nature only. So and this resection that surrounding the normal tissue, they will not do the resection. So only the affected, the defected area only they will excise the lesion or benign or whatever it is. So for excision, normal excision, the condition will be benign in nature, and the resection does not include surrounding of the normal tissue. So, okay, so code selection is based on location, size of the tumor. Okay, size is measuring the greatest diameter of tumor with the most narrow margin required. Okay, if it is complex repair is performed to close the wound, then complex repair we can code additionally. If simple repair, intermediate repair, if doctor is performing along with the excision, then no need to report simple repair, intermediate repair, code only complex repair if doctor additionally performed. Okay, so that's all about normal excision coding guidelines. Let's see radical resection of soft connective tissue tumor. So this also same guidelines only. The only one important point we have to note in this resection. So what is the radical resection? What is the normal above what we saw in the previous point? So if it is radical resection means tumor usually malignant or aggressive benign tumor in nature. So if our condition is malignant, then radical resection we have to go. If it is benign in nature, then normal excision code we have to build it. Okay, then resection, this radical resection includes surrounding of normal tissue, but normal excision does not include surrounding of the normal tissue. Okay, these 2 points we have to check thoroughly. First point, whether condition is aggressive benign or malignant in nature, or resection including surrounding of normal tissue or not. Okay, then the code is based on the like a previous point only, location and size of the tumor, and size measuring is greatest diameter of tumor with the most narrow margin required. Okay, and complex repair if doctor performed additionally, then we can build it. Simple and intermediate repair we should not build with the excision of procedure. Okay, then the same procedure like radical excision of bone or radical excision of benign. So this is based on that subcutaneous level or subfacial level or bone level. So these things you have to check, either it is a normal excision or radical resection. Then next coding guidelines is arthrocentesis or aspiration injection of joint or bursa. The code range is 20600 to 20611. So code is based on the size of the joint. So the joint is either small, intermediate or large. Okay, so code set is 2 code. So whether the code is based on the ultrasound performed utilized or not. If it is ultrasound utilized, then we have to give the combination code. Then ultrasound coding code we should not code additionally. If they are not, doctor didn't perform ultrasound but doctor utilized any MRI, fluoroscopy or CT, then additionally that 77002 or 77012 or 77021. So from these 3 code, any of the 3 code we have to bill additionally if doctor not performed with the ultrasound. If doctor utilized either fluoroscopy, MRI, CT or code from this 7 series code additionally with the 26 modifier. Okay, then the next point is if the procedure performed more than one joint, then we have to code separately for each joint additionally with the 59 modifier. So if it is doctor performed arthrocentesis only in the right and with the aspiration of the right also aspiration, then we have to bill only one unit, 20610 or 20611. If doctor is performing one joint arthrocentesis of joint or other joint doctor performing aspiration, then we have to build to this code 2 times with the 59 modifier. Okay, Then so in this CPT description, it is not included drug. So drug CPT codes, drug HCPCS code we have to bill additionally from the HCPCS two codes. Okay, for example, the provider injected 40 mg of kenolog into the left knee joint and removed 4 cc fluid from the right knee using the ultrasound guidance. So in this right side injection and left side injection and right side aspiration doctor is performing. So 2 unit we have to bill it, but with the 59 modifier 20611 times the 59 modifier. Additionally, Kenalog drugs code from the HCPCS. So this unit is based on the mg. Okay. Then next, the last topic is sacroiliac joint injection. So sacroiliac joint injection code is 27096 including guidance. Okay, if CT fluoroscopy is utilized, the 27096. If CT not used, then 20552. If sacroiliac joint performed in bilateral, then append 50 modifier to the 27096. Okay, so whenever this injection performing, especially to the sacroiliac, don't code from the normal 20610 series code. So there also you may think hip is we can code as a sacroiliac joint, but we should not code. For sacroiliac joint we have separate code 27096 code. Okay, so that's all about from the musculoskeletal part 4. So let's see in the next video respiratory coding guidelines part 1. So in third series, actually the topic will be very huge, like CAPG, pacemaker, and like injection, catheterization. So many are there from third series. So let's see one by one. So in first video will be from respiratory coding guidelines. So those who are not subscribe my channel, please guys subscribe my channel and comment, and if you have any doubt, please comment. Then if you like, please give like button. That will be useful to reach to many people. And if you feel that this channel will be useful for your friends, please share to your friends also. And thank you guys, thank you for watching my video. Thank you, bye bye.